Reducing sugary drink consumption in communities facing the highest health burdens requires understanding decision-making contexts. Behavioral economics reveals how subtle environmental modifications can shift choices without restricting options or requiring conscious deliberation, an approach proving particularly effective in lower-income neighborhoods where consumption rates and health consequences concentrate. Traditional health education assumes rational decision-making. People choose behaviors after weighing costs and benefits. However, decades of behavioral research demonstrate that most consumption decisions reflect automatic processes shaped by context rather than deliberative reasoning. This insight enables interventions modifying choice architecture rather than attempting to change beliefs or preferences. Default options prove remarkably powerful. Field experiments in corner stores testing automatic inclusion of water bottles with meal deals, requiring customers to actively request soda substitution, reduced sugary drink purchases by approximately 30% compared to stores requiring explicit water requests. The friction introduced by making soda the non-default option shifted behavior despite identical availability and pricing. Product placement exploits automatic visual attention and convenience preferences. Randomized trials repositioning water to eye-level and beverage cooler fronts, while moving sugary drinks to lower shelves or rear positions generated 15 to 20% shifts in purchase patterns. These changes require no customer education and cost retailers minimally while enabling health-supportive choices through ease rather than effort. Price salience interventions leverage psychological responses to cost information. Adding small signs at point of selection highlighting price per ounce comparisons showing water's economic advantage over sugary drinks increased water purchases measurably. The information was technically always calculable but rarely computed, making it immediately visible activated price consciousness. Bundling and meal deal structures influence choices powerfully. When retailers construct value meals automatically including water with options to add soda for additional cost, consumption patterns shift compared to meal structures defaulting to soda. The nominal price difference matters less than the psychological framing of soda as an extra rather than assumed inclusion. Implementation feasibility proves critical for real-world impact. Successful interventions typically involve minimal cost and complexity for retailers, recognizing that small businesses operate on thin margins and cannot absorb substantial burdens. Simple shelf rearrangements and placement modifications achieve impacts without expensive equipment or training requirements. Community engagement determines acceptance. Neighborhoods resent external interventions imposed without consultation, viewing them as paternalistic. Successful programs involve residents in design, ensuring cultural appropriateness and building ownership. This participatory approach improves outcomes by incorporating local knowledge while building social legitimacy. Equity considerations motivate targeting. Lower-income communities face concentrated marketing of unhealthy products, greater density of convenience stores relative to supermarkets, and higher disease burdens from poor diet. Behavioral interventions in these settings potentially reduce health disparities if implemented respectfully and combined with efforts ensuring healthy options remain affordable. Measuring impacts requires pragmatic approaches. Academic research employs careful controls and randomization, but community implementation emphasizes accessible metrics. Corner stores tracking sales data before and after interventions can assess effectiveness without elaborate research infrastructure. Customer surveys provide qualitative feedback enabling refinement. Limitations include potential demand displacement. Customers may purchase sugary drinks elsewhere if preferred products become less convenient. Additionally, small effect sizes per intervention necessitate combining multiple behavioral nudges for meaningful population impact. No single change transforms consumption patterns. Cumulative effects matter. The evidence base demonstrates that environmental design influences health behaviors substantially. Rather than lecturing communities about healthy choices while surrounding them with cues promoting unhealthy options, behavioral economics suggests engineering environments defaulting toward health. For neighborhoods disproportionately burdened by diet-related disease, these low-cost interventions represent practical tools advancing health equity through environmental modification rather than educational burden shifting onto individuals already navigating numerous economic and social challenges. When combined with complementary approaches addressing affordability, availability, and marketing exposure, behavioral nudges contribute to comprehensive strategies making healthier defaults accessible across socioeconomic contexts.